Oh, and one more thing. This gem was shared with us by our good friend Omer Reed. In the interest of hand health, asepsis, and a clean and green environment, we suggest you look into the CleanTech hand washing system from Resurgent Health. CleanTech systems perform a fully automated 12-second hand wash, sanitize, and rinse cycle, removing over 99.98% of dangerous pathogens. CleanTech's green technology uses 75% less water and produces 75% less waste than manual hand washing. By making hand washing quick and easy and enjoyable, CleanTech increases hand hygiene compliance up to 400%, while improving skin quality and obtaining a residual antimicrobial effect for up to 6 hours. Go to resurgenthealth.com to learn more. And one more. In part 2, we shared the power of four-handed dentistry. Let's take that another step and talk about three-handed hygiene and five-handed dentistry. With the addition of the IsoLite i2 or the IsoDry system, you can make the hygienist's clinical procedures so much easier with a third hand. And adding it to the dental treatment process gives the assistant an additional hand and frees them up to be more engaged in the procedure, shortening procedure time.
At IsoLite Systems, we believe better isolation equals better dentistry. Better isolation means faster, safer, more comfortable procedures for you and your patients. Less neck and back pain, and less chair time per patient so that you can grow your practice. When you really think about standard four-hand dentistry, a number of challenges emerge. The tongue is in the way, hands are in the way, suction is in the way. Patients need to be repositioned for better access or visibility, overhead lights need to be adjusted, moisture builds up from the breath, and saliva continuously soaks cotton rolls, which need to be changed, adding time to each procedure. These challenges led Dr. Thomas Hirsch to rethink dental isolation and invent the IsoLite Dry Field Illuminator, a technology breakthrough that delivers illumination, hands-free evacuation, and retraction all in one easy-to-use device.
This paradigm shift in isolation, combined with an ergonomic design that reduces fatigue and repetitive stress associated with retraction, suctioning, or otherwise repositioning the patient. Dentists using IsoLite are reducing procedure times by 20 to 30%, making the entire practice more productive and profitable. At the heart of the IsoLite system is the unique patented IsoLite mouthpiece. The soft, flexible, non-impinging IsoLite mouthpiece isolates upper and lower quadrants simultaneously, retracts and protects tongue and cheek, delivers bright, shadowless illumination throughout the oral cavity, continuously evacuates fluids and oral debris, and obturates the throat to prevent inadvertent aspiration of material. Easy to place and comfortable for the patient, the IsoLite mouthpiece can be placed in only a few seconds and removed even more quickly. The IsoLite Dry Field Illuminator is a state-of-the-art isolation solution for the modern dental practice. Using the IsoLite system, dentists and their staff members can significantly reduce procedure times while improving patient comfort, staff ergonomics, and practice productivity. IsoLite is indicated for any restorative or hygiene procedure where maintaining a clear, dry, well-lit field is advantageous. It is an excellent alternative to the rubber dam, requires no anesthesia, is easier to place, and is more comfortable for the patient. Dental professionals using the IsoLite system benefit from faster procedures, better visibility, greater access and more working room, improved isolation and moisture control, and greater patient comfort and safety. If you'd like to learn more about how IsoLite can benefit your practice, we invite you to call or visit us on the web.
Okay, we have so much great stuff we want to share. Here's one more thing. One of the reasons clinicians put themselves into postural compromises is to see what they're doing. In order to put them into a healthier posture, we also need to achieve visual clarity. The clarity objective is defined with the CareScope as bigger, brighter, and clearer. Let's begin the discussion of clarity by looking at levels of magnification. The first image shows the relative normal size of an upper bicuspid. With entry-level loops, 2.5 times magnification results in this image. With higher-end loops, 5 times magnification yields this image. Finally, look at the image on the lower left at 9 times magnification, and note the clarity of the image. These are representative of the magnification and clarity with the CareScope, but there is more to the story. With the CareScope set at maximum magnification, this lingual view of number 14 is magnified and crystal clear at approximately 30 times. Could there be any doubt in your mind or the mind of the patient that this tooth is cracked? Would seeing this detail affect the patient's desire for treatment? With bigger, brighter, and clearer as criterion, would you prefer the images on the left or on the right? Furthermore, what happens when we enlarge the images? The difference becomes more pronounced. Which of these images are bigger, brighter, and clearer? What does that mean to decision support and productivity? Let's take a look at some sample images captured with the CareScope. And here are a few more. How about those blood vessels on the lower right? What does this mean for documenting hard and soft tissue exams? With the increased awareness of the oral-systemic connection, what are the implications of a real-time multimedia co-discovery perio exam? With the CareScope system, used as it was designed, you gain a powerful benefit, comfort, and the ability to work with a healthier posture. First, with loops, a mouth mirror, and a dental light, note the posture. For a healthy posture, the angle of the clinician's neck should not be more than 15 degrees. Here we are approaching 45 degrees. Note also the amount of light beyond the area of focus in this and the next several slides. Now in this view, it gets worse, with the tilt of the head to the side. In order to see better, how often do you think that light is moved per hour, per day? That shoulder is getting a workout and slowing down the process. That same Class 4 movement was our main concern in creating an extraoral device. Now adding an assistant to the equation, you have one more head to block that precious light. Once again, notice all the light outside the mouth, which is not necessary. See the difference with the CareScope approach. Looking from over the clinician's shoulder, he is focused straight ahead at the heads-up display, with the area of interest magnified from 5 to 30 times in a live window. Observe the improved posture and head position in this picture while using the CareScope. With the CareScope in the mouth, look at the posture of the clinician. She's looking straight ahead at her heads-up display, with the active area illuminated and magnified 5 to 30 times. Now note also the illumination of the area of interest only in the oral cavity. As her area of focus changes and she moves around the mouth, the illumination and magnification follow. So as a clinician in the 21st century, the good news is you have a choice. A career of this or this. In the interest of full disclosure, the CareScope is the only best-in-class solution in which we have had a financial interest. We have had a consulting relationship with the developer from a clinical and ergonomic perspective for the past 5 years. We believe the CareScope is at the head of the class on its own merits, just like the rest of the solutions we have chosen.